Welcome to AETCM, the emergency medicine channel. Today, let us discuss about different types of insulin. Types we'll discuss, and also we'll discuss about the like dosage or regimes of insulin. We know that whenever our body is not producing adequate insulin from the pancreas, the patient develops diabetes mellitus. That means insulin is not produced adequately for the food he is taking. So sometimes we have to give oral hypoglycemic agents. Some of the oral hypoglycemic agents, they try to induce insulin secretion. They are called as secretagogues. Some of the oral hypoglycemic agents can increase the utilization of insulin in the peripheral tissues like metformin. Here we are discussing about insulin as such. Some patients require insulin because their pancreas is not producing insulin at all. They are not producing like type 1 diabetes, or the secretion of insulin even with oral hypoglycemic agents, it is very minimal. So their normal metabolism will not occur. So the blood sugar will be very high. To control that blood sugar, we have to give insulin. So there are three different types of insulin. One is fast acting. Fast acting, for example, I'll tell you, you give insulin within half an hour, the peak action occurs. Within maximum 1 or 2 hours, or up to 6 hours, the action will come down. Then intermediate acting. Intermediate acting means little more time, it may be slightly slow, and little more time it may act, maybe 12 hours, something like that. The third type of insulin, they slowly act and act for a long period, maybe 24 hours. Okay, so these are the three main types of insulin: fast acting insulin, intermediate acting insulin, long acting insulin. Fast acting we use mainly to control the postprandial blood sugar. So whenever we take food, immediately the sugar shoots up, or if pancreas is intact, it will release insulin and control the blood sugar. If pancreas is not producing insulin, then what happens is the sugar will shoot up. To control that high blood sugar, we have to give regular insulin or fast acting insulin. We give normal insulin, human insulin, regular human insulin, that is rapid acting insulin, or rapid acting analog insulin. Analog insulin means some changes occurs in the normal DNA of the insulin, and the insulin type will be completely different. The advantage of this analog insulin is, that we'll discuss afterward. Advantage of analog insulin is the antibody production against human insulin is less when we compare with the normal human insulin to analog insulin. The antibody production against insulin is very minimal in analog insulin, and they are pure form of insulin. So there is no adulteration to the insulin, so that the action will be better. Antibody production against insulin will be very low. So that whatever insulin we give to the patient, they act better than a regular human insulin. So that is fast acting insulin. Sometimes we require some fast acting type of insulin, but it has to work for little more time. Okay, so that type of insulins are also there. One of the common type of insulin is NPH insulin. So what we give, we mix the regular insulin with NPH. Normally, that is a type of insulin we get in the market. We can get fast-acting insulin also, but routinely patients take a mix of regular with NPH type of insulin. Then it becomes a long-acting with a short-acting insulin. So it will be like this. So this type of premixed insulin will have 25% or 30% of the regular insulin, then 75% of the intermediate acting insulin. So this 25% of the insulin act very fast and controls the postprandial blood sugar. The intermediate acting insulin will slowly act for next 12 hours. Then night again you will have to give another insulin before his dinner. So that there the fast acting insulin act and control the postprandial. Then throughout the night, the next intermediate acting insulin will act. So these are called as premixed insulin. Premixed insulins are available in the market. There are different type of premixed insulin that also we'll see afterwards. Long acting insulin or ultra lente or ultra lente, they act nearly 24 hours. So there is no peaks in their action. So insulin action goes like this continuously 24 hours, their release will be there. Then after 24 hours, they slowly dip down. So throughout this 24-hour day, they have a basal insulin continuously acting in the human body. The advantage of this type of insulin, the blood sugar never shoots up. So normally, if there is no insulin, blood sugar shoots up like this. So with this insulin, slight shoot up may be there, but never it go to the hypoglycemic episode. So patient mostly if the patients are on long acting insulin like Glargine, Detimer, they never go to hypoglycemic episode because there is no ups and downs in the sugar values. If the patient is taking adequate diet, it never goes to very high, it never goes to very low. So that is a long acting Lente or ultra Lente type of insulin. Now we'll see different types of insulin here. So regular insulin we have already seen. There is a most commonly used, most cheapest insulin available. In that onset will be 0.5 to 1 hour. Okay. So it is very fast acting insulin. It's a very fast acting human insulin. And the action peak will be 2 to 3 hours. Duration will be 3 to 6 hours. Whereas NPH, we'll see the NPH, the neutral protamine Egdown is a full form. NPH insulin, this is a long-acting insulin. The action starts in 2 to 4 hours. Action peak occurs in 6 to 10 hours, and it lasts for 10 to 16 hours, an average of 12 hours. And Lente, long-acting insulin, all these things are here. They are all human insulins, but the disadvantage of this insulin, after long-term use, there will be antibody production against this human insulin. These antibodies can make this insulin inactive. So after a long time, this insulin types may become inactive. So we may have to use a higher dose of insulin in that type of patients. But to avoid that or to control this problem, we have newer type of analog insulin. So there are different types of analog insulin. One is short acting analog insulin, another one is long acting analog insulin. Short acting analog insulin, mainly Lispro and Aspart. You see the range of actions. If the onset you can compare with regular insulin, that is less than 0.25 hours, that within 15 minutes it will act. It act only for half an hour to 1 hour, maximum 3 to 4 hours. So the time duration you have to compare with the regular insulin. So you can compare with the regular insulin like this. So you'll understand what is the advantage of this insulin. So if you are taking regular insulin, if the patient is taking regular insulin, you have to take at least half an hour before the meal. That is very important. At least half an hour before the meal. Then only the action occurs properly. Whereas at least 15 minutes, that is very important. But if the patient is taking this newer type of insulin along with the food or just before the food, they can take the insulin. And the advantage is patient can avoid hypoglycemia because he is taking insulin just before the food, and the action is only for 3 to 4 hours. There is no prolonged action. So there also you can avoid hypoglycemia. If the patient is fully aware about the insulin and its durations, he can avoid hypoglycemia. He takes insulin, he takes food. Within 3 to 4 hours, the action completely wean off. So that is the advantage of short-acting analog insulin. Long-acting analog insulin, you can see here, the action is nearly 20 to 24 hours. So if you are giving one dose of insulin in the morning, it continuously acts 24 hours. There is no peak or there is no dip during that period. It continuously acts for 24 hours, and patient can avoid hyperglycemia or hypoglycemia. So that is an advantage for the patient. Only thing, that will not control the postprandial shooting up of sugar. That will not be controlled by this insulin. So a patient who is taking this type of insulin may require short-acting insulin whenever he take feed just before the feed or during the feed. He has to take a short-acting insulin. We'll see the regimes afterwards. Now you can see here the aspartate, lispro, glulisin, all these things. So suppose the patient is taking food here, he also takes insulin along with the food. So immediately the sugar shoots up, your insulin also shoots up. Then within 3-4 hours, both will come down. So that is the advantage of this short-acting insulin. Instead of short-acting, you can also give the human insulin, that is regular insulin, but that is little bit delayed. The action is little bit delayed, and the duration also little more. That you should understand. Okay. Now you see the other type of insulin, NPH. NPH will be mostly given along with this regular insulin. So NPH, you take these two, short-acting regular insulin and NPH. Suppose you are mixing together and giving, that is like premixed insulin. So the acute actions or acute hyperglycemia is controlled by this regular insulin, and the long term effect is by the NPH. Okay, so these two can be given as a premixed insulin. But whereas if you are giving aspart, glulisin, lispronol, you can continue NPH for a long term control, or you can either go for detimer or glargine. The problem in chronic diabetes is there will be long-term exposure of insulin in our body. So antibodies are produced against these insulins, human insulins. So at one point of time, this insulin will become ineffective. You may require a very higher dose of insulin. In that condition, you can switch to this analog insulin. So when you are giving like that, you can give aspart along with the food and detimer or glargine to control the throughout the day. You can give for long-term control. Now insulin regimes. So there are different types of regimes. Doctors use different type of regimes. Suppose the blood sugar is 500 in a patient. Just for example, so I can give morning or 20 units regular insulin, afternoon before food 20 units, night before 20 units can be given. So totally you'll be taking 60 units. But some doctors give like this, morning and afternoon they give 20 units regular acting insulin. Night they give an NPH insulin, NPH 20 units they give. The advantage of this giving long-term insulin, so long-acting insulin, that controls the sugar throughout the night. That is advantage. But now we have premixed insulin. Premixed insulin means that contains both regular insulin with NPH. Suppose the blood sugars are 300, for example. I want to give some insulin, premixed insulin. I may give 20 units of premixed insulin. That suppose it is 25 plus 75. That means 25% of the 20 units is short acting, 75 is long acting. Morning I give 20 units, night also I give 20 units. So in that 25%, that means around 5 units act very fast, and rest 15 units act throughout the day. Night again I give 20 units of mixed insulin. The 5 units act very fast, and rest 15 units act throughout the night. So different types of regimes are there. That mixing of insulin, that is a very important thing. We are not mixing. That type of insulins are available in the market. I am not telling the brand names for this insulin because it's a clinical class. We cannot tell the brand name. So there are different combinations. 30-70. That means 30% is regular insulin, 70% is long acting, 25-75 another combination. 50-50, that you should know why 50-50 is used. Some patients take large quantity of diet, large quantity of food. Suppose his postprandial blood sugars are always high, but after sometimes he develops hypoglycemia. In that type of patients, instead of 25/75, if you give 50/50 insulin, that means here his morning sugar is 300, for example, and postprandial is 500. That means after 2 hours 500. He is taking large quantity of food. So what he give 50/50. In that 50/50, I am giving, for example, 30 units I am giving. So or 20 units I am giving, for example. So 5 units act, well, it is 10 units. 10 units act very fast. So that can control the postprandial blood sugar, and 10 units acts for a long time, that is 12 hours. So like that you can give 50/50. Those who are taking higher quantity of diet, that is very important. If their quantity of diet is very high and if their postprandial blood sugar is very high, in spite of giving a good dose of insulin, you can switch to 50/50. That is very important. Now, analog insulins, that is very important. We have already seen analog insulin means a different amino acid is added or removed at certain position along the chains of the insulin. So that is very important. We are adding an amino acid or removing an amino acid from the chains of insulin. That produces a newer type of insulin, that is completely synthetic type of insulin. It's not human insulin. The advantage of this type of insulin I have already explained. They are pure form of insulin, and the antibody production against these insulins are very minimal. The disadvantage of this insulin is it's very costly when we compare with the regular insulin. I'm not going to tell the pharmacology of this type of insulin, because where it is added, where it is removed, that all does not comes under our discussion. We are just, we can see the picture here, and different type of insulins you can learn. Insulin lispro, insulin aspart, insulin glulicin, glargine, detimar. Some of the insulins are short acting, some of the insulins are long acting. So again, regular or short acting analog insulin, short acting, sorry, analog insulin, they are long acting analog insulins are also available. The problem with this type of, it's not problem, the cost of these insulins are very high compared with the human insulin. Advantage is antibody protections are very minimal, purest form of insulin, so they act better than the human insulin. Now we have aspart, lispro, glulicin. They are all short acting insulin. The peak action, onset of action, duration of action, all we explained in detail. Detimar, glargine, degludec. The degludec is a newer type of insulin. That is also long acting type of insulin. So that insulin may act more than the other insulins, but even then we need only 24 hours of control. The advantage of this long acting analog insulin, they never have a peak or down. So the hypoglycemic episodes are very rare. That is the advantage. Insulin inhaled forms are available at present, but it has not come to the market properly in our country, but it is available all over the world. So this chart we have seen previously. Short acting insulin like lispro, aspart, glulicin, regular insulins, then long acting insulins like NPH, detimar, glargine, degludec. So all these things are very important. So you can see here degludec onset of action that was not shown in the previous chart. It is 0.25 hours, 15 minutes it can start. Peak action is 2 to 3, and the duration of action is more than 24 hours. That is the advantage. The action is more than all other insulins. Duration of action is more than all other insulins. Now regimens I have already told. These are the different types of regimens we normally give. One is if the patient is taking 3 meals in a day: morning, afternoon, night. So you give just before one lispro or aspart here, a peak action occurs here, and the action ends here. Again, Afternoon food, just one dose here. Night food, one dose here. And you give another insulin, long-acting basal insulin. Continuously you can give like this. That covers the hyperglycemic episode in between the meals. That we can give glargine, or retimar, whatever it is. So this is one type of regime. That is because normally this type of insulins, premixed insulins, are not very common, but nowadays we are getting mixture of the short acting and long acting analog insulins also. If it is like that, morning one dose you give and night one dose you give. That is enough. Morning one dose means sometimes 75 will be there. So that 25% will act very fast. Other 75% act like this. Then night you give one that act very fast. The next, the long acting insulin act throughout the night time. Now this type of regimes we have already seen: regular insulin, before breakfast, lunch, dinner, and night time you give only NPH. That is a different type of regime. There you are giving NPH only in the night time, or like we previously discussed, mix insulin that is given 2 times. That is also possible, 30 and 75%. So whatever it is, uh, we can give different. We have now like availability of insulin is in either short acting insulin separately, long acting insulin separately, or mixed dosage are available, like mix of regular 30% or 25% and NPH 70% or like 75%. Again, here analog insulins are available like this, and here analog insulins are available. So short acting analog with long acting analog mix are also available. Now, premixed insulin, different varieties are there. We have already told 30, 70, 25, 75, 50, 50. 50, 50 is very important in postprandial, high postprandial blood sugar values that we can use in that type of patients. Now, another important point when we are discussing about insulin, another important point we have to touch up is the insulin syringes. That is also very important. Like suppose somebody is taking 40 international unit per ml insulin, you need to take only this type of syringes. That syringe 1 ml contains 40 international units. But if the patient is taking 100 units per ml insulin, you have to use the same type of syringe, 100 units per ml. Instead of that, if you are using this 40 IU per ml and this syringe, the dosage will be completely wrong. That you have to take care. A doctor has to take care of this, and patient also should remember about this important fact that most of the insulins available in India is 40 IU per ml, but most of the insulins available in foreign countries are 100 IU per ml. And nowadays we are in India also, we are getting this type of insulin, so confusion can occur. So you have to remember that. Now, another important thing in insulin therapies, insulin pumps are available now. So this insulin pump continuously give insulin through its port, and the blood sugar will be taken here. Continuous glucose monitoring occurs, and depending on the glucose monitoring, sometimes the pump can give higher dose of insulin, but throughout the day it gives a normal basal infusion. Okay, so it resembles something like our pancreas. Throughout the day, it produces insulin to control the basal blood sugar value. Then whenever we take food, the pancreas releases a lot of insulin that produces surge of insulin and controls the blood sugar. And the two important effects you should remember, that especially patients who is having morning blood sugar very high. Some patients you can see morning blood sugars are very high, for example 300. There are two reasons for that. So night, suppose you are giving 20 units of insulin, some insulin. Some patients around 2 o'clock, the blood sugar due to this insulin, blood sugar drops to 50. They go to hypoglycemia. Whenever there is hypoglycemia, counter-regulatory hormones like glucagon, steroids, all secretes and the blood sugar increases after that to 300. Another type of patients is nighttime blood sugar is very high, like 400. And morning, the sugars are dropping to 300. Both conditions, you are getting 300. So we will not be knowing what is producing this high blood sugar in the early morning. For that, you need to have a early morning blood sugar value around 3 a.m. or 2 a.m. You can ask for a blood sugar value. If it is hypoglycemia producing like very high blood sugar in the morning, this is called as Somagi phenomenon. If the hyperglycemia itself is producing hyperglycemia, then it is called as Dawn's phenomenon. So depending on the 3 a.m. blood sugar, you have to reduce or increase the blood sugar. Sorry, increase the insulin. So here what you do, you reduce the night dose. You reduce to 10 units. Here what you do, increase the insulin to 30 units, increase the dose. So that also you should remember. And insulin pens are available. So whenever we take insulin, we have two options. One, you can take an insulin syringe. Cartridges are available. Syringe is available. You take from the vial and inject. If patient is comfortable, they can use with the pen because it's costly comparing with the regular vials. So we have a cartridge here. Cartridge is there. Needle is there. So that needle only we have to change. Cartridge around 300 to 400 IU may be there in that cartridge. Different types of cartridges are available. Different companies are available. So that is also available. So we have discussed about the different types of insulin which is available for our practice. So we have regular insulin, we have long-acting insulin, we have ultra-long-acting insulin, we have regular short-acting, and we have regular short-acting and regular short-acting analog insulin. We have long-acting human insulin. We have long-acting analog insulin. Analog insulin, the main advantage is it is completely synthetic insulin. So antibody production against that insulin is very less. So the destruction of insulin will not occur. Whatever we give, that will act in the body. The cost is very high comparing with the regular human insulin. The cost of the analog insulins are very high. Thank you.